I seen Maggie 2 years ago. In the clinic over in Waukesha, because that's the only place I could get in at the time. And she had another young lady with her that's learning to be a practitioner. She's still in school. Between these two ladies, I felt more relieved when I left that room than talking with any doctor. Because she was so to her, but then also the questions I had for her, she gave me all the answers I wanted to know. She's very thorough on her job. I had an episode here a couple of months back. Other than seeing the ER doctor first, she was the next one I seen. So she's right there, early morning.
Thanks, Aubrey. Appreciate that.
Are there any patients that say, oh, I don't want to see the nurse practitioner,
There
I want
are.
to see the doctor?
Yes, there are. Yeah, and that's certainly fine too, because there are patients that feel that way, and we respect that. We would never want to push services on somebody that wasn't willing to, have that. But we try to educate those people. We'll say that, I can do the same assessment, I can do the same treatment, I can prescribe the same medications. Dr. Khatib is always just a phone call away, if not in the clinic himself. So we really try to let them know that it's Dr. Khatib, that if he's not available, he would really want them to see me so that we don't have to postpone their visit for 2 weeks until he can. We can have myself kind of interject and really get them feeling better quickly. So, but there are still some that say, no, he's the doctor, I want to see the doctor, and by all means, then we'll keep them seeing him. So it does happen.
Yeah, I had an orthopedic doctor. I had to take nurse practitioner. And now I ask for her all the time.
Do you? Yeah.
I really like her, and just like you're saying, Augie.
Yeah, well, that's good to hear. And that's usually the response that we get from most patients, yeah.
You feel very comfortable being with them.
Yeah.
As well as the doctor. I mean, had my choice, either one, they're both great. They're side by side. I feel myself, Maggie knows just as much as Khatib does. Once in a while. She'll give me answers to things that I don't understand his explanation of it, So,
yeah, and sometimes, physicians can just seem more intimidating, or, they're in a rush and you don't want to keep them. So I think people just feel maybe a little bit more at ease, like it's a more casual discussion. They don't, feel they have to keep their questions to a, 1 or 2 limit. So that's some of the feedback that I've gotten, that people feel they can just, sit down and talk and have a little more time to do so. And that's nice.
I've noticed the growth you're talking about in nurse practitioners. When I started getting my heart stuff, nobody had nurse practitioners.
Right.
The 6 I dealt with this last year all had their own nurse practitioner role. And everybody, including myself, my wife too, I can talk to all my doctors, but the nurse practitioner laws take more time. And I kind of write it off to doctors being under all the pressure to see more patients. I've heard rumors that they have so many minutes to see each patient on the average. You're putting together a different schedule where nurse practitioners can take more time. Coming changes to healthcare as they may be, one way or the other be. I would like you to give a guess on your part. Are you going to always be able to spend that much time with that?
That's a good question. And I would suspect that we will. And the reason being is because it depends on which healthcare community you are employed by, but most physicians are paid on productivity, unfortunately. So yes, they do feel the pressure to see as many patients as they can, but yet providing quality care, of course. And procedures, they certainly add to one's productivity, so they need a certain requirement of that to stay afloat, if you will. Whereas nurse practitioners, most are not paid on productivity. We're assigned a certain salary. It doesn't matter if we see 1 person or 25 people. Yeah, where it does prefer the physician. So that is why we don't have those restraints as far as time goes. Like, I have requested that my patients are every 30 minutes because I want to be able to take that extra time. Yeah, so that seems long. But as all of you know, and myself being a patient, you know, by the time you get brought back, you take your vitals, they go through the medicines, I mean, that's 10 minutes of the visit. And if a physician has 15, well, what does that leave you, you know? So if I can at least add another 10 minutes onto that, that's what I'd like to do, you know, so we do have a little more sit-down talk time. But yes, unfortunately, and again, as I alluded to with all the insurance changes, I think physicians are just feeling the pressure to, you know, keep their productivity status at an elevated level. So they try to balance it the best they can, but as we know, sometimes it can be tricky.
Yeah, I'm old enough to be from the old school, so so I was one of those that, you know, I see the doctor, and of course, Dr. Khatib, I got him by chance on Christmas Eve or day before Christmas. Dr. Iglar had, when they wheeled me into the hospital, I went for a visit, you know, and I was supposed to see him just as an office visit. I ended up with the ambulance bringing me there. He said, well, once I got in the hospital, in the ambulance, I said, oh shit, you got me now. So I was there, and boy, within an hour, I was in Oconomowoc, and then I was in Waukesha on Christmas Eve, and then I was being operated on. And so, you know, you get to, you know, the doctors, but when Margie came in, and a couple times, the first time, and I went to Dr. Khatib, and he'd come in and go, look, check this and that for him. Okay, good. Yeah, well, maybe put you on blood thinner. Well, we talked about it, and that was the end of it, you know. Never went any farther. And I go in by Maggie, and I come back, and we talk about it. Man, I'm on a Zeltro. I talked to her. I said, geez, I got this AFib. You know, should I get the operation? And when she brings in Dr. High right away, holy crap, I think I'm going to have a year to goof off. You know, I don't have to worry. Here, Marcy got these guys in. I said, oh, geez, you know, I'm trapped. But I have to say that. I'm very pleased, and I have to concur with Augie and how he feels about you, and I feel the same way. And I have to say, Dr. Khatib is fortunate having you, and I feel very fortunate in having you also, because, like Archie said, we sit down for a half hour and we talk. It's things I never even knew about, you know, or talked about, and we're able to discuss them, and it is. And you're at ease, and you're not under pressure, and she brings in people from St. Jude right away, and they're checking you and everything, and so you know you feel you're in safe hands, and it's so I have a different feeling, not a different feeling, because I know because what's happening to our physicians, to what's happening to our whole health system with the care and everything that's being proposed now, that there just aren't going to be enough doctors, and it's going to have to be the nurse practitioners. And I have to go back when I was at Marquette, and I worked a lot with, got to be 20, 25 years ago. I think it was called the Physician's Assistants, that program at that time. It just started, and I thought, well, this is pretty good, pretty interesting. It's not for me, but something that has a future, and this is where it's gone. So there great strides have been taken and made, and I guess we're fortunate in having people like Margie around that are helping us along. And I have to say, I have no problem going to her and asking her, and if there's a problem, she will go to Dr. Khatib, and they'll settle it. I hope for the better, but but I'm very pleased, and thank you, Margie, for being here tonight, and for also being a great nurse practitioner. I appreciate it.
Well, thank you. I appreciate that.
Besides that, she's better looking than Dr. Khatib.
Oh, yeah, that's it. No, you can't beat that. Gloria's very nice.
That's what it was, a half hour.
But I can't see. You're too young to have accomplished all those things, all those years you spent at all these hospitals. I mean, it's amazing. So you're doing
Well,
a
that's
great
nice
job.
of you. Flattery will get you
Especially
everywhere.
with a family.
She'll spend 40
I tell you,
minutes with you tomorrow.
Yeah,
I'll give you 2 nights a Xarelto for free.
Yeah, right, yeah, yeah, that's nice, I get a prescription, there's Articulate on there, not Dr. Khatib, you say, holy great, so it's all right, it's, all things have changed, so.
Yeah, they had to bug you a while to go on that.
I
but you
know,
finally
yeah,
caved in.
well, I didn't want to go on to warfarin, that's why, I didn't want to go for the monthly testing.
Understandable.
I just didn't want to go in for, I've been going,
It's a pain.
you go into the, you've made so many visits to the hospital and to the doctors, and every month you have to go in. So that was my only drawback to it. Otherwise, if there was no other alternative, I would have gone on it, to be honest with you. But then you say, go talk to your insurance company. I did, bang, bang, and next day we had it. So it worked out that way. But yeah, that was a year or 2 years ago. I talked to Dr. Khatib, and then they denied it at first, and so we said, I just said, the hell with it, But then you brought it up. So that's where it stands. But I'm very thankful.
Well, thank you, Bob.
You're welcome.
Sounds to me, just from listening to these two, you're doing the most important job for cardiology, is taking away anxiety and fear when they're in trouble.
Well,
Sounds
thank
like you're
you.
very good at that, just from these two talking.
Yeah. Well, it is. The heart can be a scary thing, and all the disease states that can happen with the heart. Obviously, blockages, arrhythmias, congestive heart failure, cardiomyopathy. They're all very serious, and so that is one thing. I like people to understand what's going on with them, so that they can take control of it and feel, responsible for their own health care, and just not have that fear about, what's going to happen tomorrow. Of course, none of us know that for sure, but if we can work together as a team and get you on the right regimen of medications, talk about lifestyle modifications, periodic testing, lab work, so that we can stay in front of the situation instead of kind of chasing after it, that's nice. And to alleviate fear and anxiety about any disease state, certainly that's what we want to try to achieve. Because we're all scared when we go to any type of health care provider. I know I am. I'm scared when I go to the dentist.
Well, they're worse. They have no mercy.
So,
And they smile the whole time.
Yeah, it cost me a bundle for my upper implants. So.
yeah, if you can go in and feel a little less anxious, if I can at least do that, that's wonderful. So, yes.
I have a question about how is your time billed out? Now, a lot of times you're not seeing patients directly, but you're doing hospital visits for Dr. Khatib, you're doing backup,
Right.
How is that time billed out for you? Because I know the doctor, and then Medicare gets a hold of that bill and slashes it and says, here's all you're getting.
Mm-hmm.
And they have to work under that. So, how is your money, how does that get to you?
Well, it really doesn't. I'll be honest. Well,
She does this without.
She just, peanuts.
no, that's the thing. Say on the clinic side, right, they do bill under my name. So, the insurance company, they would be billed, and unfortunately, patient would be billed too under my name. When you see, at least in our specialty, it should be with all, I believe, but when you see a nurse practitioner, you're billed at 85% of what a physician would charge you. So that is another benefit. Some people like to have a little lower cost, especially if they're paying, out of pocket, or they don't have a lot of, insurance coverage in that regard. In the hospital, I would say 99.9% of the time, I will see the patient first, but Dr. Khatib will also follow behind me and see and treat that patient. So it will be billed under Dr. Khatib's name. But say if he is in a procedure and can't come on a follow-up patient, I am able to see that patient and bill for it myself.
Okay.
But best practice in the hospital setting, at least, is that the physician also sees the patient. So, but you're right, those bills go out, but that does not generate any income for myself. So, Pro Healthcare has designated a salary for me, and that's what I get no matter what I do. Of course, they don't want me sitting around, eating bonbons, so they're monitoring me. They just want to see.
Yeah,
Right.
She with Judith.
Yes.
What they do is they do monitor the work that I do, but more importantly, they monitor Dr. Khatib's productivity once again, and they have seen that it's gone up substantially since I've been paired with him, and so that's how they're kind of looking at my asset to the healthcare system.
Okay, so your salary actually comes from right from full health.
It does,
Okay.
right.
Thank you.
Any other questions?
Sure. I'd be happy to answer any questions about the heart if we have any of those questions.
Oh,
yeah, we forgot.
We forgot that.
Are you serious? You will?
Sure, yes.
I just had a catheterization last Friday, and it was something weird that I never thought, I guess I never heard of happening. All of a sudden, about 2 to 3 weeks prior, I became real short of breath, especially at night laying down. My heart started beating really weird. It would be beating at 90, jump up to 148, back down, swinging all over the place. Well, my pacemaker wouldn't do any good because the heart's beating. It's saying, yeah, that's fine. So what happened is I built fluid on just one side of my heart. The pressure on the right side was 35, the pressure on the left side was 70. So when the heart went to beat, it was beating against the pressure, and it was causing all kinds of weird things going on.
Sure.
I've never heard, I mean, how can you build up fluid on just one side?
Yeah, well, not knowing all the details about that, but there are, there's the left side of the heart and the right side of the heart, right? And you can build up pressure or fluid or resistance on one side or the other. So we call that, left-sided or systolic dysfunction, or on the right side, it's more of a right-sided heart failure, we call that. So
Okay.
it just depends on the details, but yeah, it's whether the resistance is coming from the blood that goes to the heart, that affects more the right side of the heart, whereas then it goes to the lungs, gets oxygen, comes back to the left side of the heart, and that's pumped out to the body. So it just depends if it's if the pressure is more coming to the heart or leaving the heart, if that makes sense.
Okay.
But right, any type of pressure, strain, fluid buildup on the heart can send off an arrhythmia or tachycardia or any type of electrical disturbance.
Okay, thank you.
But wouldn't, if his heart rate's going up so high, wouldn't it kick in and drop it? That's what happened to me.
No,
Yes.
I got a different pacemaker. Mine just keeps the bottom of my heart going.
Oh,
And it depends on the settings. Some pacemakers, right, if you go
you just got a
into,
pacemaker, not a pacemaker defibrillator.
Correct.
So it's coming
right,
next.
yeah.
I think the doc's gonna take this
Something
one
to look
off.
forward to, right?
His cardiologist said I never would have put that in. So
At the
that's
time
coming.
it worked.
Right. So pacemaker generally, right, kicks in when your heart's too low. A
That's
defibrillator
what mine
generally
does.
kicks in too high. But some pacemakers can try to pace you out of a faster rhythm too. So there's some benefit to just a pacemaker.
Well, I gotta go in the end of this month yet and have mine, I gotta say Jude, but it's a dual, it doesn't have the thing. And they wanna see what programming is possible with the one they got.
Okay.
And if it's not, I'm sure, listen, I have Dr. A. I think it's gonna come out.
Yeah.
Getting an upgrade.
Do you prefer one pacemaker over the other? Your devices, I should say.
Do you have to?
I would say it's their comfort level with the manufacturer. I know Dr. Khatib, we really use 3, Medtronic, St. Jude, and Boston Scientific, and really he just kind of rotates. He feels
That's what
pretty
I gotta say.
confident with all.
If I need some changes, I could say, okay, I want Boston Science.
Yes, you could. Yeah. Sometimes, say if you needed your battery changed, the leads that are attached, some are compatible between the manufacturers, but some are not. So that would be the only thing. If they weren't compatible, they would maybe have to change the battery and the leads if you wanted to go to a different manufacturer.
Any other questions?
Yeah, what is a heart biopsy? What are they?
A heart biopsy is actually taking a little piece of tissue from the myocardium, or the muscle part of the heart. And they do that routinely if they're thinking about more of a complex heart situation, such as like a restrictive cardiomyopathy or Anybody that has a heart transplant, they have to have regular heart biopsies for the rest of their life to make sure that there's no rejection of the heart transplant. But are you more so wondering about the actual procedure and how that's done, or why they have to do that?
They've done it.
Okay. And so they must be looking for some sort of like an infiltrative cardiac disease of some sort.
Okay.
Her heart rate went down to 30.
And right now they have she has the 3 doctors. She's puzzled. What's wrong?
They put the pacemaker and the defibrillator in. Get the heart rate back up where it should be. She's comfortable with that one now. They went into the biopsy, and they don't know what it is. They sent it off forwardly. They couldn't figure out what it is. Now they
Okay.
sent it to Mayo.
Yes, I was gonna say they should send it to Mayo if
And
they.
we still don't know what it is.
Okay. Did they do an MRI of your heart, a cardiac MRI? That's something that we'll also do in conjunction with the biopsy because,
Yeah, yeah.
yeah.
It's our
okay.
daughter we're talking.
Okay. Yeah, generally, I don't know, again, the details, but that's when we're looking at more of like an infiltrative cardiac process, which they're more rare. Sometimes they do take a long time to diagnose. And many times, right, those patients will send biopsy results to Mayo, or we'll actually have the patients go to Mayo for a full evaluation, so. Yes?
If you have a pacemaker, can you have an MRI?
Can you have an MRI? I would say the majority, no.
Freighter can,
Freighter
Freighter
would.
can do it, they did
Okay.
it.
Yeah, they can, yeah, they're the only
They
ones
did it
that.
for him.
Now, do you have a newer pacemaker though, or have
St.
you had
Jude,
it
it's
for
been
a
in
while?
about 4 years.
Okay, because most manufacturers are coming out with MRI compatible
Right.
pacemakers. But I would say the majority of patients, the ones that they have in up to this time frame, cannot. Yeah. Although I haven't heard that, so I'm gonna have to look into it.
Yeah, they just did I was part of a study that they did. What did they go about the MRI for? Cancer? Anyway, it was here's the thing. Most pacemaker manufacturers say that their pacemakers would withstand an MRI. Insurance companies say no. And that's the fight. So they did a study that came out of California. I was part of it at Freighter. Went through a special thing, and it's quite a procedure because you have one person there from the St. Jude. You have a cardiologist right there. And I had 2 people from that were running the MRI.
Sure.
And what they do is they back off your pacemaker, almost shut it down, and then monitor you. It's called MRI mode, actually.
Okay.
It's built right into your pacemaker. And it kind of shuts it down, and then so that the magnetic fields won't start sending a bunch of false signals out. And when you come out, they put the thing on and fire it back up.
Well, that would be a great option. Is that open to the general public now? Do you
Yes.
know? Can anyone go there for the MRI?
Well, yeah, I
will look into that. Thanks for letting me know.
Yeah, I mean, I can't remember if it was a stroke that they were, anyway, they needed an MRI. And I said, well, I can't have one done. And they said, yes, you can. But Freighter doesn't.
Right.
And I they wanted 2,500 participants, and they were like at 1,900 already when I did mine. And Freighter had done almost 600 of them already.
Okay.
So yeah, you can if you
Yeah,
need it.
that's great, because, we resort to a CAT scan, but for some
Right.
things, an MRI is really, what's needed to diagnose. So I'm glad that you brought that up.
Yeah, so, I mean, yeah, it is possible, and
Any other questions? I'm just gonna ask her a question and I'll get on with the meeting.
Did they put a shield or anything on it?
nope. Not that I'm aware of.
Yeah.
But they, no.
Yeah.
I feel like you're in a fishbowl and everybody's looking at you.
I was in there for
Okay.
quite a long time, and you can't, you know, you can't.
Yeah, I know.
And they were doing my head, and anyway, they had my chin locked, and, yeah, I could not move. They had things pushed up against the side of my head and felt on my chin. They were there like that.
Don't cough.
But I was shocked, because I was told all over, no, you don't do them, you gotta,
I thought I had heard you say that.
yeah, and they will do it.
I just don't want that thing flying across the room.
Yeah.
All right, well, thank you all for having me. I really appreciate it. So give your nurse practitioners a shot, see what you think, you know. We need more fans out there, but they are growing. I appreciate it. Thank you.